Hi, everyone. So I'm with Karys, a partner of a patient named Jordan, and they're from Australia. Karys, tell us a little bit about yourself, and thank you for doing this with us. Actually, I'm going to say something a little bit about Karys. Um, she's become a good friend, actually, and it's weird how TSW can bring people together. We would have probably not met outside of this community, and it's really fun watching her energy and her vibe and just her really, really cool soul flutter around the clinic. And it's been really fun getting to know her. So, Karis, tell tell the world about you
Oh,
before we
thank
talk about Jordan.
you. Yeah, no, thank you. I feel like flutter is the perfect word. I'm just like always floating around.
You are flutter.
But yeah, thank you so much for having me on to chat. So yeah, my name's Karys. I'm from Australia. I grew up in Melbourne, and yeah, we lived by the coast near Byron Bay for the last couple of years. And yeah, have moved to Bali last year and now Thailand. So been all over the place.
Before we talk about Jordan and
Yeah.
TSW and CAP and all that, what do you do? What keeps you busy? Because you're here, you're supporting your partner, but like, what do you do every
Yeah.
day?
Yeah. Well, I'm studying naturopathy. So I've been studying for maybe 6 months now. And I work for myself. So I do marketing for health and wellness companies. And yeah, I love it. I love my job. I love studying. It keeps me very busy.
How has your sort of past and everything that Jordan's going through and you two are navigating together um, influenced your decision to pursue naturopathic medicine?
Yeah, for sure. We kind of spoke about this when we first met. Have grown up like with an eating disorder for most of my life. So that kind of was the beginning of Jordan and I's relationship. I was recovering from my eating disorder, and he became my carer for quite a while. So, the shoe is well and truly on the other foot now, as I care for him through his topical steroid withdrawal. But yeah, I think that both of these life, major health issues have influenced my decision to, yeah, really put my career into my own hands, my health into my own hands, and yeah, follow my heart and do something that I know is going to help others.
Thank you. Thank you for sharing that. And I'm sure that as you progress in your journey as well, people will be interested in watching how you transform everything you're learning now into your world of naturopathic medicine. So tell us a little bit about Jordan's journey, your journey. You're here. You've been here in Bangkok now for how many months?
6 months now.
Really
It's gone
already?
so quickly.
I mean, we just saw Jordan in the
Yeah.
treatment room, and maybe it's like a little flare, but boy, does he look good.
Looks
And
so
we're gonna talk
good.
about Cap, but like
Yeah.
you tried Bali, you
Yeah.
tried all these other things.
Yeah.
Tell us a little bit about what that looked like for you guys.
Yeah, so Jordan started TSW in December 2021. He, yeah, was going through years of topical steroid addiction. Just his skin was continuously flaring. So at that point, he kind of was just like, all right, we made an informed decision kind of together, knowing that there might be, at that time, we thought maybe 9 months ahead of us of some pretty hard days. But yeah, no, so December 2021, he started off, with no moisture treatment. So he did 3 months straight off the bat of that. And yeah, it was a really, really rough time. I guess our lives just kind of flipped on their heads, going from, yeah, both of us being out at the beach every day, going for walks together, to him just being completely debilitated, not being able to kind of move from the couch and becoming a full-time carer on top of kind of taking over his workload, and, sustaining a full-time job so that we could kind of keep going, I guess. Yeah.
Can I ask you, was it no moisture, no shower, or was it no moisture, no creams?
Yeah. Yeah. He went full on with the no shower, um, limit water intake, like the whole thing. So it was quite intense for a while. Yeah.
And I mean, it sort of turns what we learn when
Mm,
we get here on its head. We don't need to dissect no moisture
sure.
treatment, but did Jordan arrive with a fungal infection? Does he have a fungal infection? Because we know that that kind of
Yeah.
correlates. Okay.
Yeah, for sure. And I think he doesn't regret his time doing no moisture treatment. I think starting off his TSW journey in that way has probably helped maybe with like not developing hardened skin. So I think that that was a positive to that time.
Yeah.
And I guess, it's also unknown. Like you just go along with whatever best information you have at that time. And in Jordan's case, he's getting a lot of recommendations
I was
constantly.
going to say people are offering lots of advice,
Yeah,
which is
which is
nice.
so nice. And yeah, it's amazing. Like the amount of advice that comes through and people wanting to help. But yeah, I guess for him, it's hard to dissect which ones are, worthy of his time and energy. So,
Before we move on to CAP,
mm.
anything you want to say about your time in Bali as it related to this?
Yeah, I guess so. We moved to Bali yeah, we were kind of hoping that moving to a humid climate would help Jordan's skin. He'd done 3 months in Thailand the year previous, and that really helped his skin.
Not CAP, just
Not
being in
cat,
Thailand.
yeah, just being in Thailand, just the humidity had helped his skin so much. So, yeah, we kind of packed up all of our things. We moved to Bali with our 9 suitcases. We are fully packed. So, yeah, we kind of had made that decision that we'd be there for a while. And then when we got to Bali, we found like long-term accommodation. But unfortunately, the place that we were staying in had a lot of mold, and his skin just went crazy. And yeah, it kind of we hit that rock bottom point where we were like, okay, we need something else because we can't continue this journey.
So, speaking of advice, I know you get a lot of advice,
Yeah,
which is somewhat how you got here.
yeah,
Can you talk a little bit about coming to Bangkok and how you ended up here?
for sure. So I think, yeah, as I was saying, George gets so many messages daily with, try this, try that. This helped my cousin's sister's friend, and which was all amazing, but it can be quite overwhelming. So we'd seen CAP treatment come up quite a few times. We'd seen people say, try CAP, try CAP. And there was almost this like we kind of talk about like this cult vibe that we were like, oh God, like what is this? It sounds like too good to be true. But yeah, I got an email sent to me from Ravina, which is, yeah, a very dear friend of yours as well. She's a carer as well. And the email that she sent was just so heartfelt, brought me to tears. She was so wonderful and kind, as we know she is. And yeah, she just suggested like CAP treatment. And at that time, George was really struggling. And we kind of had 2 options in our head, like, do we go medical route or do we go and try CAP? And it's like, well, why wouldn't we try CAP treatment first? We're not too far from Thailand. We're 4 hours away. We've already moved out.
Yep.
We've got no ties back to Australia right now. So yeah, why not give it a go?
So, just to clarify, Jordan had not tried any immunosuppressants, biologics, none of those things.
No.
Okay.
No.
So, you end up here, and I know the first thing is figuring out your accommodation. The first question you get in your induction is Jordan read in the morning.
Yeah.
You'll probably
Yeah.
talk about that, but what was it like? You get here, you you know
Yeah.
you're you arrive and you go to your first induction and treatment.
Yeah, it was amazing. I think the initial consult we had with Jay was like 2 or 3 hours, and him just going through in detail all of this information that you just are not taught in, like, you can do as many Google searches, listen to as many podcast videos as you can, but the information that Jay gives in that first appointment is so tailored to the person, and we finally like felt like someone understood, especially a health professional. We've had amazing health professionals who are willing to help George, but they just don't understand. So it was just so nice to get that. And I guess, yeah, the first 4 weeks were rough. The treatment was really, or just moving to Thailand, and yeah, George was dealing with like a lot of infections and weeping and oozing, and his skin getting used to the cap treatment. That was a really rough sort of month when we initially got here.
We'll talk about that in just a sec,
Mm,
because you probably have a million lessons learned that you can
yeah.
share with other caregivers and also patients. But what did you learn about Jordan's case on that first day?
Yeah, so I think Jordan takes the cake out of all.
Right, it's not a medal anyone
No,
wants.
but honestly, I'm like, babe, of course. Like, he's an overachiever and he's used an exorbitant amount of steroids. I think in the initial consult, we worked it out to be around 7. I think in chatting more recently, I think he said above 10, maybe 12 kilos of steroids in his life. Where, before George and a few other patients here, I think Jay had seen people like up to 2 kilos. So yeah, I guess knowing that, right, this is like a lifelong thing that we're going to be dealing with. Um, and yeah, just gave him a medal.
So, two questions for you. Obviously, that's a lot. It's a lot to take in, take on, not take on personally, but it's a lot. So, you guys, how have you processed that information, knowing that this is something that you're going to grapple with, but know how to manage? And then, secondly, what do you say to people out there that are probably watching this that think maybe I've used that many, and what potency did Jordan use? Because I think that matters as well. Well, I know that
For
matters
sure.
as well in the healing
Yeah,
journey.
for sure. So, just the last bit of that question, it was class 1 and 2 steroids. So, yeah, the most potent. But yeah, I guess being here, we have experienced like this light at the end of the tunnel that we hadn't experienced on this journey. And even knowing that this is something that we're going to have to manage our entire lives, it's still just knowing that there, like, he does have the ability to go about life semi normally. And like, obviously we're going to be having to manage like infections, irritants, allergens, and yeah, really planning our life around it. But yeah, I honestly think we've both come into this journey, even knowing that it's a lifetime thing, that we've got a lot of hope. Yeah.
Thank you for sharing that. So, Karis, you said that first month was obviously challenging because you're learning the ropes. Everything that you know, everything that you've been taught, everything that dermatologists have told you is literally being turned on its head.
Yeah.
Correct?
Yeah. Yeah.
What have you learned? What have you learned about supporting a patient going through topical steroid withdrawal? Uh, what can you advise people at home, families, patients? Give us some
Yeah.
tips and tricks.
For sure. I mean, yeah, like as I said, the first month here, I think I called Ravina. I sent her a message in that first week. I was beside myself, just being so like in a new place and like getting used to everything. As a carer, it's like finding your pharmacy and like your shopping centers and like getting all the basics down pat is super overwhelming. And then on top of that, Jordan's skin flaring, like back to day one, essentially. That's how it looked anyway. So, yeah, I guess the thing that we kind of touched on before, just noticing if Jordan would wake up in the morning less red or if it had increased. I think that's a really important one to know if the environment that you're in is suitable. We've been so lucky that George has found, like, our apartment that we've found is like such an amazing healing place for him. I guess the flaking as well. I think we've always had these thoughts that flaking is a bad thing. And in those initial phases when the skin's like building up, especially when your skin is so thin, flaking is actually a positive sign that like your skin is like actually, yeah, your cells are proliferating. So, yeah, I think those two things. I think also just being patient with the journey. It's different for everyone. And at the end of the day, I think you've got to do what works for you. I found that, with George's, some of Jay's advice, like, I love we love Jay's advice. We wouldn't go against it. But we also found that there were stuff that it just worked for Jordan better. So like wrapping up his arms would avoid him from scratching. So I think it's also using the information that Jay shares, but also with what works best for you and like not suffering.
Yeah. More on a personal note, how are you keeping your mind, your heart, your sort of aura, because you do have this really great aura about you. How do you keep yourself and your cup filled while you're navigating such a amazing but challenging journey?
Yeah, I think one thing that I've noticed in the last couple of years is that when you're in survival mode, you've just got to go with it. And it's the same with patients, I'm sure. It's like sometimes you've just got to listen to your body. If you've got to numb out, because that's the only way to get through the week, the day, the month, that is okay. It's not, a long-term solution, but in those really hard days, it's hard to, be bubbly. It's hard to feel something. So I think, just giving permission to yourself to be as you are, and when you're ready, being able to deal with those emotions that come up. And I think
work probably also gives you that juice, and studying again, like,
for sure.
How, what a wild time in your life to be doing that, but what a good time, right?
Yeah, I think being able to diversify your day, and like I'm so lucky I've got work to kind of keep me
so busy.
Yeah. So it's nice to have something outside of just being a carer as well. So just having something that this is my own, and that's why I chose to study even amongst this like crazy busy time. I was like, that is for me. So
it must give you some sense of relief though to see Jordan bounce back as quickly as he is, right? Because before it was sort of, and I don't want to put words in your mouth, but it was like, it's a flare, now what? Right? The flare could last for a long time.
100%.
And now, I mean, you guys are just back from Koh Samui, which was a lovely trip, but you know what you have to do. So maybe just share, I don't know, maybe your feelings or thoughts around the bounce back.
Yeah, it's actually amazing just seeing how Jordan's skin is able to bounce back now. Whereas originally, he might have a flare and it would last for months. And we'd be in this like cycle of like just, I'm trying to come up with a word that's not swearing. A bad cycle.
Yeah. Be a nightmare.
That's the Aussie in me coming out, wanting to swear. So I think just seeing him bounce back so quickly, and just his energy levels are amazing. He's like a pocket rocket.
He's bouncing
He's
around.
crazy.
It's awesome.
Yeah, we love it. We love to see it. I'm like, whoa, 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 whoa. Hang on. Calm down for a second. We don't want to overwhelm ourselves. But I'm so happy for him. I'm just let him go. Yeah.
On the bouncing around part, you guys have taken on a big project, and I know he's driving it. And with his audience, with both your joint knowledge now, with the support of the entire community that is here in Thailand, using CAP as one modality to heal, you're putting this huge work together and putting this documentary together. He's running around after some of the patients that have used larger amounts of steroids. I think that's how it was determined with some people dealing with more challenging bacterial, fungal, and hardened skin challenges. Like, what do you hope to both accomplish with this documentary, and can you share maybe some insights or timelines with us?
For sure. I mean, this is Jordan's baby, so I can't take any credit for it whatsoever. I think I helped out with a couple of interviews. But yeah, I think, not to put words into Jordan's mouth either, but I think this documentary is an opportunity for him to share with people the dangers of topical steroids, what topical steroid withdrawal is. Jordan's goal with Control and all the work he's doing there is always set around, removing the need for topical steroids. So really reaching people who have eczema and other skin conditions to put a stop to it and say, you don't need these, there are other options. So I think just being here in Thailand around so many people with topical steroid withdrawal, this is why you do these interviews too. Like, it's amazing just the more advocacy that we can all do to share. It's for me, it reminds me a lot of the opioid crisis in the States. It's a really,
and Canada.
It's such a heavy, opioid crisis everywhere, but it is so serious, and the fact that it impacts every internal system, every external system that we have in our bodies it's just mind-blowing that there is just no awareness around it.
Thank you for sharing that. And it just gave me a vision, very exciting vision, of the two of you partnering in a bigger way as you finish up school and you become certified and you can practice. I think it could be really neat. So watch out for that, I think, guys. Karys, anything you want to say to people that are watching? The job of a caregiver is no small one. And also, you're your own person, and it's really fun to watch you, flutter about and do your thing here, and get to know you in this way. So any sort of closing remarks, final words?
I guess one thing that I've really learned being a carer is to be able to lean on others and ask for help when you need it. And also taking time out for you is so important. There's so many times where I just need to have a break, and that's okay. You're so entitled to that. Like you said, you are your own person, and as much as it is important to care for those people around you, you can't care for someone if you're not caring for yourself. So
thank you. What a gorgeous ending.
No, and thank you for having me.